Cardiogenic Shock. What's up, guys? EMT 2319. So let's talk cardiogenic shock, all right? Because if you're working in EMS, you're going to see this, okay? And when you do, it's game time, all right? Cardiogenic shock happens when the heart fails to pump enough blood to meet the body's needs, all right? Not because the heart is stopped, but because it's too weak to push the blood forward, okay? So most of the time, we're talking about post-MI, okay? Massive infarction kills off enough muscle that the heart just can't generate enough pressure, all right? Some less common causes, we're looking at myocarditis, end-stage heart failure, okay, valve rupture, arrhythmias like VTAC, for example, all right? Result is low cardiac output, systemic hypoperfusion, fast-moving death if we don't intervene, all right? So what are we going to see? All right, well, we're going to see a couple of things, okay? One, we're going to see hypotension, all right? Usually a systolic under 90, okay? Two, we're going to see an altered mental status, all right? The brain's just not getting enough blood, all right? We're going to see cool, clammy skin, classic sign of shock, guys. We know that, okay? Tachycardia, all right? The heart's just, it's trying to compensate and it's failing, okay? Pulmonary edema, watch for the crackles, the pink frothy sputum, respiratory distress. If you see blood pressure and wet lungs, you need to think cardiogenic shock, all right? So what's our move in the field? Well, we got a couple things we can do. One, high flow oxygen, okay? Two, position them upright if they can tolerate it, okay? It helps with breathing. Three, wide bore IV access, guys, all right? Four, 12 lead early, okay? Look for those signs of infarction or ischemia, okay? Now, you need to be careful with fluids, okay? This isn't hypovolemic shock, okay? Too much fluids can drown them, okay? So you need to be careful with that. You might need to start pressors, okay? This is usually after you talk to medical command. But some of the go-tos for pressors are dopamine, your norepinephrine, all right? You got to remember, guys, cardiogenic shock is lethal, okay? So it's on us to recognize it, move fast, treat what we can, and try to get that definitive care moving forward, all right? Stay sharp, guys, all right? Lives depend on it.